The South African Medical Association, SAMA, says that it's inundated with calls from medical doctors who are extremely worried about contracting the coronavirus from their patients. This after the government decentralized testing for the virus. To discuss this a little further, we're now joined via Skype by Dr. Angelique Coetzee, who's the Chairperson of the South African Medical Association. Thanks so much indeed for joining us. Welcome to the program. Just what are the doctors worried about?
Good afternoon, and good afternoon to all the listeners out there. Doctors are extremely worried in two ways. The one is about their own health, their own safety, of everyone working for them. And secondly, we are also worried about the patients. It seems to us that there is a huge panic around under the public regarding the coronavirus, COVID-19, which is part of the family of the coronavirus. And we need to make it extremely clear that 80% of patients will have a slight flu or flu-like symptoms, especially a lower respiratory tract, which means not a sinus, not a running nose, not sore ears, but a dry cough and maybe a bit of respiratory distress or a bit of impairment there. But we are not worried about that 80%. It is the people who's vulnerable, the elderly, people with a low immune system. And as doctors are trying not to get the patients into our surgeries, that we that is complaining of the respiratory tract infection, because we don't know who's sitting in the waiting room, only coming in for that surgery, and then on top of sitting in the, or as part of, as to you, they are in the coronavirus or the COVID-19 virus by someone not listening or sitting too close to them.
So what's the ideal situation? What should we be doing then?
I understand there is no ideal situation. South Africa is as prepared as we can. It's not very much prepared, but that is not because we are South African. It's a worldwide disease, and the disease in each country will have its own peculiar peculiar disease profile that is not maybe similar to what is in Italy or China. And also South Africa has a lot of chronic diseases. We've got one of the highest TB rates in the world, one of the highest HIV rates in the world. So we know that this is going to affect us in a bad way. Not again the 80%, but the 20% of people with these type of diseases. So what do we need to do? Common sense. Stay at least away 1 to 1.8 meters, if it's possible, from any person around you, especially if they are sneezing or coughing, because you never know whether it's a normal flu or whether it is part of the corona, because you can have both pictures. You can have flu-like symptoms, that is normal flu. We are going into our flu season. You can have an allergic type of cough that we also see because it's a seasonal changes. And then on top of it, you can have the corona. So it's always safe to assume that everyone is infected, to lessen contact with other people. Again, you can wash your hands 20 seconds with normal soap and water, not antibacterial soap, because it's not a bacteria, it's a virus. Also, try not to touch your face, and if you sneeze into a tissue, and throw the tissue into a dustbin, because someone else should not come behind you and pick it up. Also, make sure that if you're not feeling well, before you go off to the pharmacist or the doctor, rather phone, give them your symptoms and advice. And listen to when they tell you, go home. You must give us a lot of intelligent questions or answers like, I can't stay home because of my work. I cannot take responsibility for a patient today. And you need to listen. Now is not the time to think about yourself, but also about the 20% of people, of which 8 or 10% are going to be extremely. That is our problem.
All right, Dr. Coetzee, we're going to have to leave it there. The line's not the best, but I think we heard the very important message that you had to share with us, and we certainly wish the best for the medical staff across the country. Thanks so much indeed for your time.